Well, hello everyone. We are back on the Healthful Roots podcast. This is Dr. Victoria Andarcia. I am so sorry for the hiatus. This was not intentional. However, as you may or may not know, I have been shifting from Healthful Roots to working at Reveal Vitality, which is a longevity clinic in downtown Sarasota. So, what does that mean? Healthful Roots is going to be no more because I found an opportunity to work in a clinic downtown that is doing everything I wanted to do and more. So it's an opportunity for me to grow, learn, and treat people in an in-person setting, as Healthful Roots was just telehealth based. And truly, as you may have seen in my posts, I was burned out. So for the last 3 years of Healthful Roots, it was amazing. I got to help so many people and I learned so much about business and also how to make this kind of style of medicine work for different people, which was exactly what I needed. It was a bridge to this job, and I'm so thankful for Healthful Roots, but also very thankful for the opportunity to now be working at Reveal Vitality. So it was just a necessary change because while I was doing Healthful Roots and while it was growing, I also had to work in the hospital for the income that was needed at that time that your business is growing. If you've ever started a business, I 100% applaud you because it is tough. But through working in the hospital and working with Healthful Roots, it just became too much. And I tell my patients all the time that they need to take care of themselves, they need to sleep, they need to rest. And I was not doing any of that. So I decided I had to take my own advice. And like I said, I'm actually very excited about this opportunity at Reveal because there's a lot of cool stuff happening here that I haven't been able to do for a while, like peptides. I'm jumping into peptides again. I had been doing it when I first started Healthful Roots, but kind of fell away as part of my practice, and now we're back into peptides. So what are peptides? Let's just jump into that really quick before I go into the rest of what I wanted to talk about. So peptides are small amino acids that are messengers in your body and tell your body to do a certain thing. There are many different ones. The ones that I use more commonly is one, BPC 157. So that one is used to help with joint and gut, just because it's good at helping rebuild the gut lining, but also at helping with collagen production and just what your joints need to sustain and continue to function without pain. So that's my favorite one. The other one is CJC with ipamorelin, or you can do the ipamorelin alone, but I like that combination. And that one tells your body to make more growth hormone. That one is very good, I find, for several things. One, for sleep. If people are struggling to sleep, it helps with building muscle, it helps with energy, helps with focus, can help with libido, not intentionally, but it can help with libido. I like that one. TB 500 is one for also healing. There's very various ones for healing, TB 500 being one of them. The other ones are DSIP, which is good for people who struggle with insomnia. You have CellInc, which is good for concentration. There's just like so many different ones. So I've started using that again. And I really think that it's not to be used alone. Usually they work better in stacks or as a good addition to hormone replacement therapy if you are on hormone replacement therapy. So that's what one of the things that I'm doing here that I'm excited to be doing again. But I was just coming on to give you an update, but then also to talk about hormones, as that is my main focus. And this coming Thursday, September 25th from 5:30 to 7 p.m., we're going to be doing a hormone happy hour here at Reveal Vitality, downtown Sarasota. The details are in the link in my bio. If you don't follow me on Instagram, it's Dr. Victoria Andarcia. No periods or anything in there. And you can find the link in that in my bio. There's also a link to the webinar that I'm doing on September 24th at 6 p.m. Eastern Time. That is going to be similar. We're going to be talking about hormones and perimenopause and menopause, but it's just not an in-person event, which is fine because I just want everyone to have an opportunity to be part of the discussion. Why am I talking about this? Well, I think that perimenopausal and menopausal women are often neglected. And I think that there is a lot of misinformation out there that we need to kind of wrap our heads around and start educating people on really the benefits of hormones and what are the risks of hormones, but like truly the risks, not just say, oh, hormones cause cancer, because we know that that's not true. And I think that we just need to do a little better. I don't know how recent the stat is from, because it shocks me if it is, but the stat said that less than 5% of menopausal women are on hormone replacement therapy, which is very shocking, which is a lot lower than it was obviously before, uh, you know, someone read the WHI studies and then concluded that hormones gave cancer and then everything went way down. So just to give you a taste of two of the things that we're going to be talking about in the webinar, but also that we're going to be talking about during the in-person event. The first one, something near and dear to my heart, is osteoporosis. And I don't know why it bothers me so much, but like I really get triggered by osteoporosis because it is preventable. So one of the indications that the FDA has approved hormone replacement for is for the prevention of osteoporosis. But we're not using it. Really, like we're not taking advantage of the fact that there is something that is FDA approved for the prevention of bone loss. We're just not, which is crazy to me. Because if you read the effectiveness of some of these medications that we're using after the fact for osteoporosis, it's actually very poor. So it's much better to prevent than it is to try to cover and fix that fact after. So key is prevention. You're trying to fix osteoporosis after the fact. It's going to be really hard and probably not very effective. How do I know what my bones look like and what do I have to be doing? Well, that's a great question because I think that we're testing for bone loss way too late. So the insurance companies will approve your bone scan 65 or older, except that if you get to 65 or older, chances are that you already have osteoporosis. So great. We definitely didn't do a great job screening you there. Personally, what I tell all my women when they come in, all of them, no matter of age, well, 35 plus, is that they should be getting a bone scan because really that's when you can do something about it. If in your 40s you see, wow, like my bones are a little bit weak, okay, well, what can you do? Well, maybe hormone replacement is something that you need, but if it's not, then I need to change what I'm eating. I need to change how I'm working out, and I need to be really proactive to do the workouts that are going to help me build muscle, right? Are you going to start a weightlifting program at 70? Yeah, you can, but it's going to be a lot harder than starting in your 40s. My recommendation then is if you are in your 40s and you haven't had a bone scan, it is time to go and get that bone scan. See where you're at and then see what you have to do about it. Prevention is much easier than trying to fix something that is broken. Why? It's just a broken bone. Who cares? Actually, it's a big deal because 1 in 4 women who have a fracture after menopause will end up in a nursing home. That's 25% of women. And then 1 in 2 will not return to their baseline function after that fracture. So what does that mean? Maybe you were playing tennis with your gals, or you were really active in your garden, or you really liked running around and playing with your grandkids. Well, maybe now you're walking with a walker and you're limited. And it's hard for you to go grocery shopping. And people have to bring you stuff. So then you're not using your muscles. And then you get deconditioned. But muscle is currency for health. But if you can't use them, then you're going to become like chair bound or bed bound, or you're just going to get really sick overall. And then the decline in your health begins from that. So that is why I am such a big proponent for taking care of your bones because they literally keep us upright and out of nursing homes. So that is one of the things that we're going to be talking about on my webinar, but also at the hormone happy hour event. What is the second thing I'm going to bring up? The second thing that I'm going to bring up is interesting because it's common in 50 to 80% of women in menopause, perimenopause. It can start in perimenopause and just gradually gets worse in menopause. And yet nobody talks about it really. And what's interesting is that I did a hormone panel a couple weeks ago, room of 20 women. Nobody was going to ask the question. I brought it up because I'm like, this is kind of weird. We need to talk about this. And then the room erupted in conversation. Everyone was like, oh, yeah, I've had that. Oh, that sucks. Oh, man, I'm so glad that you brought that up. And then everyone started having side conversations on this topic. And I was like, well, that's weird. If it's that common and nobody was going to ask me, why? Well, could be because it's a little bit embarrassing maybe for some people, even though I'm a doctor and I don't think that any of this stuff is embarrassing. It's an uncomfortable topic for some people. Maybe. What is it, you may ask? Well, it's genital urinary syndrome of menopause. What is that? Well, as estrogen declines in your body, so does lubrication in the vaginal area. That can cause atrophic vaginitis, which is dry. Your vagina is dry. You don't have enough lubrication. Sex becomes painful. You have, sorry, that was a weird noise outside. So pain with sex becomes common. And then the other thing is that you are at increased risk of urinary infections, which, as also a hospitalist, someone who has worked in the hospital, I have seen many women come in with sepsis, especially older ladies, secondary to a urinary tract infection. And then you talk to their families, and their families are like, oh, she just gets UTIs all the time. And this is her third or fourth or fifth one this year. That's not normal. And it's preventable. So what do we do about it? Okay. Well, you can start vaginal estrogen, whether it's a cream, a suppository, there's rings that you can insert in the vagina that are estrogen rings. And what's very cool about that is that you can notice improvement in the tissue within 2 to 3 months, and then you can continue to use it with less frequency. You can decrease the frequency once that tissue has gotten better, regenerated a little bit. You can also use DHEA suppositories. DHEA is a hormone that splits off and makes both estrogen and testosterone. So it is a hormone. Its brand name is called Intra Rosa. You might have heard of that. And this is just not about sex, but I don't want to get older and have recurrent UTIs. I recently put my grandmother on this because she had had multiple UTIs in a short period of time. And there's really no cutoff to the age that you can use the intravaginal estrogen. One, you can even use it postpartum when your estrogen levels drop if things become uncomfortable. And in perimenopause, you might start to feel dryness, and that is a time when you can start proactively using the intravaginal estrogen or DHEA to help with these symptoms. So this is going to be another topic. We can go into it a little bit more. There's a lot of other things that kind of go with it, but I'm going to stop there for a second because I want to spotlight this book. So I read You Are Not Broken by Dr. Kelly Casperson on vacation recently. And I mean, aside from the fact that I love her as a physician, I think she's amazing. She's a wonderful teacher. She's really good at explaining things. This book was very well written, easy to read, interesting. She makes it fun, but it's basically a sex ed book for women, but she also really spends a lot of time talking about the changes that happen in perimenopause and menopause, society's expectations of what sex should be or what it is now. And then it just talks about things that you can do to improve libido, sexual health. If you're having pain with sex, what do you do? What are your options? And I think that it's a really good read, but I would say that it's also a really important topic. Doctors don't really ask this. I'm going to be honest. I used to be uncomfortable talking about this more so because I didn't know how my patients were going to react to this. But now I'm starting to ask questions about sex life. Are you enjoying it? Is it painful? And if they say, well, I'm not having sex with my partner, the next question is, well, do you want to? Because if someone doesn't really care that they're not having sex with their partner, I'm not going to push it forward. But if they do care, I've had many women sit in front of me and cry because it's painful or something else is going on and they're not having intercourse with their spouse or partner. And that's heartbreaking because we have solutions to whatever is going on physiologically that is putting a barrier. Now, there are also medications for hypoactive sexual desire. That's something that can be addressed as well. You have hypoorgasmic disorder, so people who can't have orgasm, there's also treatment for that. You just have to ask, because if your doctor doesn't know, then how can we help you? But also you have to go to the right doctor, because not all doctors are trained in this, and some of them might not be super comfortable having this conversation. So you have to find the right doctor is the other thing. But I would say that if you're one of the women who is struggling with this, just read You Are Not Broken, or you can go to my webinar or come to the in-person event, because we are going to be talking about this and more and things that can be done. Highly recommend. So those are two of the topics. There's going to be more that we're going to be addressing with these two events, because I think it's just important to normalize these conversations and give people a safe space to ask questions. So if you have any questions, you can always just send me a DM. I'd be happy to answer them. If you pop onto the webinar, I can answer it there. But I just wanted to kind of give you an idea of what's coming up this week. Then as far as life updates, kind of gave you one a little bit at the beginning. I have my last week of working in the hospital, September 29th through October 6th. And after that, I will no longer be a hospitalist. I will only be working at Reveal in downtown Sarasota. So some of the things that we offer is that there's a longevity center downstairs. If you're working, you can choose just to be in the longevity center. We have cryo, hyperbaric oxygen. We have red light therapy, neuro reboot, which helps calm your nervous system. There's a sauna down there. There's a gym down there. They have workout classes, which is amazing. There's small group classes, up to 5 people. So you really get personalized attention. Then the other thing is upstairs, we have our clinic and we have 3 providers. We have Dr. Davis, who's the owner of the clinic. He's a very well-known cardiologist. Then we have Dr. Angela Jordan. She is our Lyme and cancer specialist. She also works with children. And then we have me, which I do a little bit of everything. But as you know, my focus has been hormones and gut health for a long time. Whether you are struggling with fertility, PCOS, perimenopause, or menopause, I would love to be part of your journey. And I think that for my first episode coming back, that's all I've got today. Unless you have any questions that you want to bring up or ask me, I can add that on to the next podcast. My next podcast is going to be with my colleague, Dr. Angela Jordan. So I look forward to doing that with you. And that's it. That's all I've got. Well, hope everyone has been doing well in my absence. And again, I'm sorry for being so busy, but I hope to see you at one of the upcoming events. And if not one of these, the future ones that we do.